Question 1. Risk assessment procedures indicate that a patient presents to the emergency department following a fall with a reported loss of consciousness for approximately 30 seconds. The patient is currently alert and oriented, denies headache, and reports no focal neurological deficits. However, the mechanism of injury involved a direct blow to the temporal region of the head. Which of the following represents the most appropriate initial management strategy to ensure best practice evaluation for potential traumatic brain injury, TBI? Option A. Perform a comprehensive neurological examination, assess vital signs, and consider neuroimaging based on the mechanism of injury and any subtle findings, while closely monitoring for any changes in mental status or neurological function. Option B. Immediately administer broad-spectrum antibiotics to prevent potential infection, as head trauma can compromise the immune system. Option C. Focus exclusively on managing any superficial scalp lacerations and defer further neurological assessment until the patient reports new symptoms. Option D. Rely solely on the patient's subjective report of no symptoms and discharge them with instructions to return if symptoms worsen, as they are currently alert and oriented. The correct answer is A. Perform a comprehensive neurological examination, assess vital signs, and consider neuroimaging based on the mechanism of injury and any subtle findings, while closely monitoring for any changes in mental status or neurological function. Explanation. This scenario presents a professional challenge due to the inherent complexity of traumatic brain injury, TBI, assessment and management, particularly in the acute phase. The need for timely and accurate evaluation is paramount, as delayed or inappropriate interventions can lead to significant morbidity and mortality. Professionals must navigate the dynamic nature of TBI, considering evolving neurological status, potential for secondary injury, and the need for multidisciplinary collaboration. Careful judgment is required to prioritize interventions and ensure patient safety within the established regulatory and ethical frameworks. The correct approach represents best professional practice by adhering to established guidelines for TBI management, which emphasize a systematic and evidence-based evaluation. This includes a comprehensive neurological examination, assessment of vital signs, and consideration of imaging modalities to identify structural damage. The focus on early identification of neurological deficits and potential complications, such as intracranial hemorrhage or edema, aligns with the ethical imperative to provide timely and effective care. Furthermore, this approach promotes patient advocacy by ensuring that all necessary diagnostic and therapeutic steps are considered, leading to optimal outcomes. Regulatory frameworks, such as those governing the practice of neurology and emergency medicine, mandate adherence to best practices and the use of validated assessment tools. An incorrect approach that relies solely on subjective patient reporting without objective neurological assessment fails to meet professional standards. This neglects the potential for altered mental status or communication difficulties in TBI patients, leading to an incomplete and potentially dangerous evaluation. Ethically, this constitutes a failure to provide adequate care and could violate principles of beneficence and non-maleficence. Another incorrect approach that prioritizes immediate discharge without a thorough diagnostic workup, especially in cases of suspected moderate to severe TBI, is a significant regulatory and ethical breach. This overlooks the potential for delayed symptom onset or the development of serious complications, putting the patient at undue risk and violating the duty of care. A third incorrect approach that involves bypassing established protocols for imaging or specialist consultation when indicated by initial assessment findings is also professionally unacceptable. This can lead to misdiagnoses, delayed treatment, and adverse patient outcomes, contravening professional guidelines and potentially violating licensing board regulations. The professional decision-making process for similar situations should involve a structured approach. 1. Rapidly assess the patient's airway, breathing, and circulation ABCs. 2. Conduct a focused neurological examination, including assessment of level of consciousness, pupillary response, motor function, and sensory deficits. 3. Obtain a detailed history of the injury mechanism and any pre-existing conditions. 4. Consider the need for immediate neuroimaging based on clinical presentation and established TBI severity criteria. 5. Initiate appropriate medical management and consult with relevant specialists, e.g., neurosurgery, critical care as indicated. 6. Continuously monitor the patient's neurological status and vital signs, anticipating and managing potential complications. 7. Document all findings, interventions, and patient responses meticulously. Question 2. Quality control measures reveal that a neurologist specialist's gait and balance assessment for a patient with suspected Parkinson's disease primarily relied on the patient's self-reported difficulty with walking and turning, with minimal objective testing, beyond observing the patient walk across the room once. The patient subjectively reports significant unsteadiness and a feeling of shuffling, but denies any falls. The neurologist's notes indicate a diagnosis based solely on this subjective report and the patient's history of tremor. Which of the following approaches best represents a comprehensive and professionally sound gait and balance assessment in this scenario, adhering to established neurological clinical practice guidelines? Option A. Incorporate standardized objective measures of gait speed, stride length, and turning velocity, alongside a detailed observational gait analysis under various conditions, e.g., tandem gait, dual tasking, and a formal balance assessment like the Borg balance scale, while still considering the patient's subjective experience. Option B. Conduct a brief, informal assessment of static balance by asking the patient to stand on one leg for a few seconds, and then rely on the patient's subjective report to guide treatment decisions. Option C. Focus solely on the neurological examination for tremor and rigidity, assuming that these motor signs are the primary determinants of gait and balance deficits in Parkinson's disease, and that subjective reports are less critical. Option D. Prioritize the patient's subjective report of unsteadiness and shuffling, as this directly reflects their lived experience and functional limitations, and proceed with treatment based on this information alone. The correct answer is A. Incorporate standardized objective measures of gait speed, stride length, and turning velocity, alongside a detailed observational gait analysis under various conditions, e.g., tandem gait, dual tasking, and a formal balance assessment like the Borg balance scale, while still considering the patient's subjective experience. Explanation. Scenario analysis. This scenario presents a common challenge in clinical practice where a patient's subjective report of gait and balance issues conflicts with objective findings from a standardized assessment. The challenge lies in reconciling these discrepancies to formulate an accurate diagnosis and effective treatment plan. Professionals must exercise careful judgment to avoid over-reliance on either subjective complaints or objective scores, recognizing that both provide valuable, albeit sometimes incomplete, information. The complexity is amplified by the need to consider potential underlying neurological conditions that might manifest subtly or be influenced by factors not immediately apparent. Correct approach analysis. The correct approach involves a comprehensive, multifaceted assessment that integrates the patient's subjective experience with objective clinical measures and considers potential contributing factors. This aligns with best professional practice by prioritizing patient-centered care and evidence-based decision-making. Specifically, it emphasizes the importance of 1. Detailed history taking, understanding the patient's perception of their gait and balance deficits, including onset, triggers, impact on daily life, and any associated symptoms. This respects the patient's lived experience and can uncover nuances missed by standardized tests. 2. Observational gait analysis. Observing the patient's gait in various conditions, e.g., walking normally, tandem gait, turning to identify specific abnormalities in pattern, speed, stride length, and stability. This provides a dynamic, real-world assessment. 3. Standardized balance assessments. Utilizing validated tools like the Borg balance scale or timed up and go test to quantify balance deficits and track progress. These provide objective benchmarks. 4. Neurological examination. Performing a thorough neurological exam to identify specific deficits in motor control, sensation, coordination, and proprioception that could underlie gait and balance problems. 5. Consideration of other factors. Evaluating for non-neurological contributors such as visual impairment, vestibular dysfunction, musculoskeletal issues, medication side effects, or psychological factors. This integrated approach ensures a holistic understanding of the patient's condition, leading to a more accurate diagnosis and personalized management plan, which is ethically mandated to provide competent and comprehensive care. Incorrect approaches analysis. An approach that solely relies on the objective scores of a standardized gait and balance assessment, disregarding the patient's subjective report, is professionally unacceptable. This fails to acknowledge the patient as the primary source of information about their functional limitations and can lead to underestimation of the problem's impact. Ethically, it violates the principle of patient autonomy and shared decision-making. It also risks missing subtle but significant functional impairments that may not be captured by the chosen assessment tool. An approach that dismisses the objective findings of a standardized assessment in favor of the patient's subjective complaints without further investigation is also professionally unacceptable. While patient reports are crucial, objective data provides a quantifiable baseline and can highlight areas of concern that the patient may not be fully aware of or able to articulate. Ignoring objective data can lead to misdiagnosis, delayed treatment, and potentially serious consequences if an underlying neurological condition is not adequately addressed. This approach can also be seen as a failure to adhere to evidence-based practice, an approach that focuses exclusively on a single aspect of gait or balance, e.g., only assessing static balance, without considering the dynamic nature of gait and the interplay of various systems, is also professionally flawed. Gait and balance are complex, multifactorial phenomena. A narrow focus can lead to an incomplete picture of the patient's functional capacity and limitations, resulting in an inadequate assessment and treatment plan. This represents a failure to apply a comprehensive and evidence-informed approach to neurological assessment. Professional reasoning. Professionals should approach gait and balance assessment with a systematic, patient-centered, and evidence-based framework. This involves 1. Active listening and empathy. Begin by thoroughly understanding the patient's concerns and how their gait and balance issues affect their life. 2. Comprehensive assessment design. Select and administer a battery of assessments that includes subjective reporting, observational analysis, standardized objective measures, and a targeted neurological examination. 3. Integration of findings. Critically analyze and synthesize all gathered data, looking for convergence and divergence between subjective and objective findings. 4. Differential diagnosis. Formulate a list of potential diagnoses based on the integrated findings, considering both neurological and non-neurological etiologies. 5. Collaborative decision-making. Discuss findings and potential diagnoses with the patient, involving them in the decision-making process for further investigations and treatment. 6. Continuous reevaluation. Recognize that gait and balance can fluctuate and require ongoing monitoring and reassessment. Question 3. Regulatory review indicates that following a severe ischemic stroke, a patient's family is expressing significant distress and a desire for aggressive, experimental treatments, despite the clinical team's assessment of a poor prognosis for meaningful recovery and the patient's previously documented wishes for limited life-sustaining interventions. What is the most ethically and regulatorily sound approach for the neurology clinical specialist to take in managing this situation? Option A. Insist on the clinical team's treatment plan, dismissing the family's concerns as stemming from grief and lack of medical understanding. Option B. Facilitate a multidisciplinary team meeting involving the patient's surrogate decision-maker to discuss the patient's current status, prognosis, and the alignment of proposed treatments with the patient's previously expressed wishes and goals of care, while providing empathetic support to the family. Option C. Immediately initiate the most aggressive, experimental treatments requested by the family to honor their immediate emotional needs and avoid conflict. Option D. Inform the family that the patient's prognosis is dire and withdraw all supportive care without further discussion, as per the patient's prior wishes. Correct answer is B. Facilitate a multidisciplinary team meeting involving the patient's surrogate decision-maker to discuss the patient's current status, prognosis, and the alignment of proposed treatments with the patient's previously expressed wishes and goals of care, while providing empathetic support to the family. Explanation. This scenario presents a professionally challenging ethical dilemma common in neurology clinical practice, specifically concerning the acute management and rehabilitation of a patient with a severe stroke. The challenge lies in balancing the patient's immediate medical needs and potential for recovery with the family's emotional distress and differing perspectives on care goals. The principle of beneficence, acting in the patient's best interest and autonomy, respecting the patient's previously expressed wishes, if known, or their right to make decisions, are central. The regulatory framework for neurological specialists emphasizes evidence-based practice, patient-centered care, and clear communication. The correct approach represents best professional practice because it prioritizes a structured, multidisciplinary team discussion that includes the patient's surrogate decision-maker and the clinical team. This approach ensures that all available information regarding the patient's neurological status, prognosis, and potential benefits and burdens of different interventions is considered. It aligns with ethical guidelines that mandate shared decision-making, even when the patient cannot participate directly, and regulatory requirements for comprehensive patient assessment and care planning. Open and empathetic communication with the family, acknowledging their grief while gently guiding them towards realistic expectations based on clinical data, is crucial. This fosters trust and facilitates a collaborative approach to care, ultimately serving the patient's best interests. An incorrect approach that focuses solely on aggressive, potentially futile interventions without a thorough discussion of prognosis and goals of care fails to uphold the principle of non-maleficence, avoiding harm, and may lead to unnecessary suffering and resource utilization. This could be considered a regulatory failure if it deviates from established standards of care for stroke management and rehabilitation. Another incorrect approach that prematurely withdraws all supportive care without adequate exploration of the patient's potential for recovery or family understanding of the situation disregards the ethical imperative of providing appropriate care and support. This could also represent a regulatory failure by not adhering to guidelines on end-of-life care discussions and palliative support. A third incorrect approach that dismisses the family's concerns and insists on a specific treatment plan without engaging in a dialogue about their understanding and fears neglects the ethical principle of respect for persons and can lead to significant distress and a breakdown in the therapeutic relationship. This is a failure in communication and patient-centered care, which are often implicitly or explicitly mandated by regulatory bodies. The professional decision-making process for similar situations should involve 1. A comprehensive assessment of the patient's neurological status and prognosis. 2. Identification of the patient's surrogate decision-maker and exploration of any known advance directives. 3. Facilitation of open, honest, and empathetic communication with the surrogate, addressing their concerns and providing clear, understandable information about the patient's condition and treatment options. 4. A multidisciplinary team meeting to discuss the case, formulate a shared understanding of goals of care, and develop a consensus on the management plan. 5. Ongoing reassessment and communication as the patient's condition evolves. Question 4. System analysis indicates a patient presents with a new onset of blurred vision in the right eye and a slight droop of the right side of their face. As a neurology clinical specialist, NCS, what is the most appropriate initial approach to assessing this patient's cranial nerve function? Option A. Focus the examination primarily on the optic nerve and facial nerve, as these are most directly implicated by the reported symptoms. Option B. Perform a brief, targeted assessment of the cranial nerves most likely involved, documenting only the positive findings. Option C. Conduct a comprehensive cranial nerve examination, systematically assessing all 12 cranial nerves, correlating findings with the patient's reported symptoms and medical history, and formulating a differential diagnosis. Option D. Ask the patient to describe their symptoms in detail and rely on their self-assessment to guide further diagnostic steps. The correct answer is C. Conduct a comprehensive cranial nerve examination, systematically assessing all 12 cranial nerves, correlating findings with the patient's reported symptoms and medical history, and formulating a differential diagnosis. Explanation. Scenario analysis. This scenario presents a challenge in a neurology clinical specialist, NCS, role by requiring the assessment of cranial nerve function in a patient with a potentially evolving neurological deficit. The challenge lies in accurately identifying the affected cranial nerves, correlating findings with potential underlying pathologies, and determining the urgency and appropriate next steps in management, all while adhering to established clinical guidelines and ethical responsibilities. The NCS must integrate subjective patient reports with objective examination findings to form a comprehensive clinical picture. Correct approach analysis. The correct approach involves a systematic and thorough cranial nerve examination, beginning with observation and progressing through specific tests for each nerve. This systematic approach ensures that all cranial nerves are assessed, minimizing the risk of overlooking subtle deficits. The NCS should then correlate the identified deficits with known neuroanatomy and common neurological conditions, considering the patient's reported symptoms and medical history. This allows for the formulation of a differential diagnosis and the identification of red flags that necessitate immediate referral or further investigation. This aligns with the NCS's professional responsibility to provide evidence-based care, maintain competence, and act in the patient's best interest, as outlined in professional practice standards and ethical codes that emphasize thoroughness and accurate diagnosis. Incorrect approaches analysis, focusing solely on the most commonly affected cranial nerves without a complete assessment, risks missing critical information. This failure to conduct a comprehensive examination could lead to a delayed or incorrect diagnosis, potentially harming the patient. Ethically, this approach breaches the duty of care by not providing a complete and competent assessment. Relying exclusively on the patient's subjective description of symptoms without objective verification is also problematic. While patient reports are crucial, they can be influenced by various factors and may not fully capture the extent or nature of a neurological deficit. This approach fails to meet the professional standard of objective clinical assessment and could lead to misdiagnosis. Performing a rapid, superficial assessment without detailed documentation or consideration of differential diagnoses is another unacceptable approach. This demonstrates a lack of diligence and professional accountability. It increases the risk of errors and does not provide a clear record for subsequent care providers, violating principles of good medical practice and record keeping. Professional reasoning. Professionals should approach cranial nerve assessment with a structured methodology. This begins with understanding the patient's chief complaint and relevant history. The examination should then proceed systematically, testing each cranial nerve individually and in a logical sequence. Findings should be meticulously documented, noting both positive and negative results. The NCS must then synthesize these findings, considering the patient's overall clinical presentation, to generate a prioritized list of potential diagnoses. This process guides the decision-making regarding further investigations, referrals, and management plans, ensuring patient safety and optimal outcomes. Question 5. The assessment process reveals a 65-year-old male with a 3-day history of progressive confusion, fever, and a new onset of focal neurological deficits, including right-sided weakness. Physical examination reveals a temperature of 102.5 degrees F and nuptial rigidity. Given the suspicion of meningitis or encephalitis, a lumbar puncture is indicated. Which of the following is the most critical initial step before proceeding with the lumbar puncture? Option A. Administering broad-spectrum antibiotics immediately to cover potential pathogens. Option B. Ensuring the patient is adequately hydrated to prevent hypotension during the procedure. Option C. Preparing the lumbar puncture tray with all necessary sterile equipment. Option D. Performing a CT scan of the head to rule out increased intracranial pressure and mass lesions. The correct answer is A. Administering broad-spectrum antibiotics immediately to cover potential pathogens. Explanation. The assessment process reveals a patient presenting with new-onset neurological symptoms suggestive of an inflammatory or infectious process within the central nervous system. The core challenge lies in obtaining diagnostic cerebrospinal fluid (CSF), while ensuring patient safety and adhering to established clinical guidelines for lumbar puncture. This scenario demands careful consideration of contraindications, patient positioning, sterile technique, and appropriate specimen handling to yield accurate diagnostic results without compromising patient well-being. The correct approach involves a thorough pre-procedural assessment to identify any absolute or relative contraindications to lumbar puncture, such as signs of increased intracranial pressure, local skin infection at the puncture site, or significant coagulopathy. Following this, meticulous sterile technique during the procedure, proper patient positioning to maximize intervertebral space, and appropriate needle selection are paramount. The collected CSF must then be handled according to laboratory protocols, including immediate transport and appropriate storage, to prevent degradation of cellular components and biochemical markers. This comprehensive approach aligns with best professional practice by prioritizing patient safety, minimizing the risk of complications, e.g., infection, neurological injury, post-dural puncture headache, and ensuring the integrity of the diagnostic sample, thereby facilitating accurate diagnosis and timely management of the patient's condition. Adherence to these principles is implicitly guided by professional standards of care and institutional policies, which are designed to uphold patient safety and diagnostic accuracy. An incorrect approach would be to proceed with the lumbar puncture without a thorough assessment for contraindications. This poses a significant risk of serious complications, such as brain herniation if there is increased intracranial pressure, or introducing infection into the CSF if the skin is not adequately prepared. Another incorrect approach is to disregard sterile technique, which directly violates fundamental principles of infection control and significantly increases the risk of iatrogenic meningitis, a severe and potentially life-threatening complication. Failure to properly label or transport CSF samples, or to use appropriate collection tubes for specific analyses, leads to compromised diagnostic accuracy, potentially resulting in misdiagnosis or delayed treatment. These failures represent a breach of professional responsibility and ethical obligations to provide safe and effective patient care. The professional decision-making process for such situations should involve a systematic evaluation of the patient's clinical presentation, a comprehensive review of their medical history for potential contraindications, and a clear understanding of the procedural steps and their associated risks and benefits. This includes consulting relevant clinical guidelines and institutional protocols. When in doubt about the presence of contraindications or the appropriate management of a specific situation, seeking consultation from a senior clinician or specialist is a crucial step in ensuring patient safety and optimal care. Question 6. Implementation of genetic testing results revealing a significant predisposition to a hereditary neurological disorder in a patient who expresses reluctance to inform their adult children due to fear of causing them distress, presents an ethical challenge for the neurology clinical specialist. The specialist has identified that the patient's siblings also carry a high risk. What is the most ethically and professionally sound course of action for the neurology clinical specialist? Option A. Directly contact the patient's adult children and siblings to inform them of their genetic risk, explaining that this action is for their potential benefit. Option B. Document the genetic findings and the patient's refusal to disclose, and consider the matter closed without further action or discussion regarding family implications. Option C. Advise the patient that they have a professional obligation to inform their family and strongly encourage them to do so immediately, regardless of their personal feelings. Option D. Respect the patient's autonomy by not disclosing the genetic information to the family, but offer the patient resources and support to help them communicate with their children if they choose to do so in the future. The correct answer is D. Respect the patient's autonomy by not disclosing the genetic information to the family, but offer the patient resources and support to help them communicate with their children if they choose to do so in the future. Explanation. This scenario presents a significant ethical dilemma for a neurology clinical specialist, NCS, regarding the disclosure of genetic information within a family. The core challenge lies in balancing the patient's autonomy and right to privacy with the potential benefit of informing at-risk relatives about a genetic predisposition to a neurological condition. The NCS must navigate complex ethical principles, including beneficence, acting in the best interest of others, non-maleficence, avoiding harm, and respect for autonomy. The specific regulatory framework for the neurology clinical specialist NCS exam, which is assumed to be US-based for this example, would heavily influence the acceptable course of action. US regulations and ethical guidelines, such as those from the American Medical Association AMA, and potentially state-specific genetic privacy laws, would be paramount. The correct approach prioritizes direct communication with the patient about the implications of their genetic findings and empowers them to make informed decisions about disclosure. This aligns with the principle of patient autonomy, a cornerstone of U.S. healthcare ethics and law. Encouraging the patient to inform their family, the NCS respects the patient's control over their personal health information while facilitating potential harm reduction for at-risk relatives. This approach also adheres to the principle of beneficence by enabling proactive management or monitoring for family members who might benefit from early detection or preventative measures. The NCS acts as a facilitator and educator, not an unauthorized informant. An incorrect approach would involve the NCS unilaterally disclosing the genetic information to the patient's family members without the patient's explicit consent. This would violate the patient's right to privacy, a fundamental ethical and legal principle protected by laws such as HIPAA, Health Insurance Portability and Accountability Act. In the U.S., such a breach could lead to significant legal repercussions and erode patient trust. Another incorrect approach would be to dismiss the genetic findings as irrelevant to the family, thereby failing in the duty of beneficence towards potentially at-risk relatives. This would ignore the potential for early intervention and preventative strategies that could significantly impact the health outcomes of family members. A third incorrect approach might be to pressure the patient into disclosing the information, which would infringe upon their autonomy and right to make their own decisions about their personal health information. The professional decision-making process for similar situations should involve a systematic ethical analysis. First, identify the ethical principles at play: autonomy, beneficence, non-maleficence, and justice. Second, consider the relevant legal and regulatory frameworks, including patient privacy laws and professional guidelines. Third, engage in open and empathetic communication with the patient, exploring their understanding of the genetic findings, their concerns about disclosure, and their wishes regarding informing family members. Fourth, provide comprehensive education to the patient about the implications of the genetic findings for their family and the potential benefits and risks of disclosure. Fifth, collaboratively develop a plan for disclosure that respects the patient's autonomy, such as offering to help facilitate the conversation or providing written information for the patient to share. If the patient refuses disclosure, the NCS must respect that decision, while still offering support and resources to the patient. Question 7. The audit findings indicate a need to enhance the comprehensive assessment of patients with neurological conditions. When evaluating a patient with newly diagnosed Parkinson's disease, which of the following approaches best integrates social history and lifestyle factors into the clinical management plan? Option A. Proactively inquire about the patient's daily routine, dietary habits, social support network, and any substance use, and use this information to tailor education on symptom management and potential lifestyle modifications that could impact disease progression and treatment adherence. Option B. Ask general questions about the patient's living situation without delving into specific habits or routines, assuming that the patient will independently manage any lifestyle-related challenges. Option C. Focus exclusively on the neurological examination findings and prescribed pharmacological interventions, as social and lifestyle factors are secondary to the established medical diagnosis. Option D. Document the patient's stated occupation and marital status, but refrain from exploring personal habits or daily activities, as these are considered private matters outside the scope of neurological care. The correct answer is A. Proactively inquire about the patient's daily routine, dietary habits, social support network, and any substance use, and use this information to tailor education on symptom management and potential lifestyle modifications that could impact disease progression and treatment adherence. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the neurologist to balance the patient's immediate clinical needs with the broader implications of their social history and lifestyle. The audit findings highlight a potential gap in comprehensive patient assessment, moving beyond purely biological factors to encompass the psychosocial determinants of health. The neurologist must navigate the ethical imperative to provide effective care, while respecting patient autonomy and avoiding assumptions or biases related to lifestyle choices. The challenge lies in integrating this information meaningfully into the treatment plan without alienating the patient or overstepping professional boundaries. Correct approach analysis. The correct approach involves a sensitive and non-judgmental exploration of the patient's social history and lifestyle factors as they directly relate to their neurological condition and treatment adherence. This aligns with the principles of patient-centered care, which emphasizes understanding the individual within their unique context. Regulatory frameworks and ethical guidelines for neurologists, such as those promoted by professional bodies and potentially reflected in clinical practice standards, advocate for a holistic approach. This includes recognizing how factors like diet, exercise, social support, and substance use can impact neurological health, symptom management, and the effectiveness of interventions. By gathering this information, the neurologist can tailor treatment plans, provide targeted education, and identify potential barriers to care, ultimately leading to better patient outcomes and adherence. This approach is ethically sound as it respects patient dignity and promotes shared decision-making. Incorrect approaches analysis. One incorrect approach involves dismissing or minimizing the relevance of social history and lifestyle factors, focusing solely on the neurological diagnosis and prescribed medical treatments. This fails to acknowledge the significant impact these factors can have on a patient's overall health and their ability to manage their condition. Ethically, this approach can lead to suboptimal care by overlooking potential modifiable risks or barriers to treatment adherence. It may also be perceived as a lack of empathy or a failure to provide comprehensive care, potentially violating professional standards that encourage a holistic view of the patient. Another incorrect approach is to make assumptions or judgments about the patient's lifestyle choices without adequate exploration or understanding. This can lead to biased treatment decisions and alienate the patient. For example, assuming a patient will not adhere to a specific diet due to perceived lifestyle habits without discussion is unprofessional and unethical. Such an approach can violate principles of respect for autonomy and may lead to discriminatory practices, which are contrary to professional ethical codes and regulatory expectations for equitable care. A third incorrect approach is to collect social history information in a perfunctory manner, without integrating it into the clinical decision-making process. This means gathering data, but not using it to inform the treatment plan or patient education. This represents a failure to provide comprehensive care and can be seen as a missed opportunity to optimize patient management. Ethically, it is a disservice to the patient if relevant information is collected but not utilized to their benefit, potentially leading to preventable complications or reduced treatment efficacy. Professional reasoning. Professionals should employ a decision-making framework that prioritizes a comprehensive and empathetic assessment. This involves 1. Recognizing the interconnectedness of social determinants of health and neurological conditions. 2. Employing open-ended, non-judgmental questioning techniques to elicit relevant social history and lifestyle information. 3. Actively listening to the patient's concerns and perspectives. 4. Integrating the gathered information into a personalized and collaborative treatment plan. 5. Providing education and support tailored to the patient's individual circumstances and potential barriers to adherence. This systematic approach ensures that care is not only clinically sound, but also ethically responsible and patient-centered, adhering to the highest professional standards. Question 8. Quality control measures reveal a consistent underdocumentation of atrial fibrillation screening in patients presenting with transient ischemic attack (TIA) symptoms, despite established guidelines recommending prompt assessment for this arrhythmia as a primary stroke prevention strategy. Which of the following represents the most appropriate and compliant approach to address this identified gap in care? Option A. Conduct a retrospective chart review to identify specific instances of missed screenings and issue individual performance feedback to the clinicians involved. Option B. Advise the clinical team that atrial fibrillation screening is a recommended practice and encourage them to be more diligent in their documentation during TIA evaluations. Option C. Focus on updating the hospital's general stroke protocol to include a broader statement on risk factor assessment without specifically addressing the atrial fibrillation screening deficit identified. Option D. Implement mandatory, real-time electronic health record prompts for atrial fibrillation screening during TIA evaluations, and provide targeted educational modules to the neurology team on the latest evidence-based protocols for arrhythmia detection and management in stroke prevention. The correct answer is D. Implement mandatory, real-time electronic health record prompts for atrial fibrillation screening during TIA evaluations, and provide targeted educational modules to the neurology team on the latest evidence-based protocols for arrhythmia detection and management in stroke prevention. Explanation. Scenario analysis. This scenario presents a common challenge in clinical practice where a gap is identified between established best practices for stroke risk factor management and actual patient care delivery. The professional challenge lies in translating quality control findings into actionable, evidence-based interventions that are both effective and compliant with the regulatory framework governing neurological care. The need for careful judgment arises from balancing patient autonomy, resource allocation, and the imperative to adhere to established guidelines to prevent adverse outcomes. Correct approach analysis. The correct approach involves a systematic, multifaceted strategy that directly addresses the identified gap. This includes reinforcing the importance of evidence-based guidelines for stroke risk factor assessment and management, such as those promoted by relevant professional neurological societies and potentially mandated by healthcare oversight bodies. Implementing targeted educational initiatives for the clinical team, focusing on specific risk factors like hypertension, hyperlipidemia, diabetes, and atrial fibrillation, is crucial. This education should emphasize current diagnostic criteria, therapeutic targets, and the rationale behind preventative strategies. Furthermore, refining clinical workflows to ensure consistent screening, documentation, and follow-up for these risk factors aligns with best practices and regulatory expectations for quality patient care. This approach is best professional practice because it is proactive, evidence-based, and directly aims to improve patient outcomes by mitigating modifiable stroke risk factors, thereby fulfilling the professional and ethical duty of care. It also supports compliance with any quality metrics or performance standards set by regulatory or accreditation bodies. Incorrect approaches analysis. One incorrect approach would be to dismiss the quality control findings as minor deviations without further investigation or intervention. This failure to act on identified deficiencies represents a breach of professional responsibility and potentially violates regulatory requirements for continuous quality improvement in healthcare. It neglects the ethical obligation to provide the highest standard of care and could lead to preventable patient harm. Another incorrect approach would be to implement a superficial solution, such as a one-time educational seminar without follow-up or integration into clinical practice. This approach fails to address the root causes of the identified gap and is unlikely to lead to sustained improvement. It also demonstrates a lack of commitment to evidence-based practice and may not meet the standards expected by regulatory bodies for effective quality assurance. A third incorrect approach would be to focus solely on punitive measures for clinicians rather than a systemic improvement strategy. This can create a defensive environment, hinder open communication about challenges, and distract from the primary goal of improving patient care. It also fails to acknowledge that systemic issues, rather than individual failings, may be contributing to the observed gap, and it may not align with regulatory frameworks that emphasize a culture of safety and learning. Professional reasoning. Professionals should approach such situations by first acknowledging the validity of the quality control findings. The next step is to conduct a root cause analysis to understand why the observed deviations are occurring. This involves engaging the clinical team to identify barriers to optimal care, which could include knowledge gaps, time constraints, or system inefficiencies. Based on this analysis, a targeted intervention plan should be developed, incorporating evidence-based strategies and educational components. Crucially, mechanisms for ongoing monitoring and evaluation of the intervention's effectiveness must be established to ensure sustained improvement and compliance with professional standards and regulatory mandates. This iterative process of assessment, intervention, and evaluation is fundamental to maintaining high-quality neurological care. Question 9. System analysis indicates a 72-year-old male present to the emergency department with sudden onset of left-sided weakness and expressive aphasia. The patient's family reports the symptoms began approximately 45 minutes prior to arrival. As the neurology clinical specialist, what is the most appropriate initial approach to the neurological assessment? Option A. Immediately initiate a comprehensive neurological examination, including cranial nerves, motor strength, sensation, reflexes, and coordination, followed by vital signs. Option B. Prioritize a rapid assessment of key NIS components, vital signs including blood pressure and oxygen saturation, and a brief, targeted history of symptom onset and progression. Option C. Obtain a detailed past medical history and review all available laboratory results before commencing any physical examination. Option D. Rely on the patient's verbal description of his symptoms to determine the extent of neurological deficit. The correct answer is A. Immediately initiate a comprehensive neurological examination, including cranial nerves, motor strength, sensation, reflexes, and coordination, followed by vital signs. Explanation. Scenario analysis. This scenario presents a professional challenge due to the potential for rapid neurological deterioration in a patient with a suspected acute stroke. The urgency of the situation necessitates a swift yet thorough neurological assessment to guide immediate management decisions, which have significant implications for patient outcomes and resource allocation. The complexity arises from balancing the need for speed with the requirement for accurate and comprehensive data collection, all within the established protocols for stroke care. Correct approach analysis. The correct approach involves a systematic and prioritized neurological assessment that focuses on identifying key indicators of stroke and its severity. This includes rapid evaluation of the National Institutes of Health Stroke Scale (NIS) components, assessment of vital signs, blood pressure, heart rate, oxygen saturation, and a brief but targeted history focusing on the onset and nature of symptoms. This approach aligns with established clinical guidelines for acute stroke management, emphasizing the time-sensitive nature of interventions like thrombolysis and thrombectomy. The regulatory framework for neurological specialists mandates adherence to evidence-based practices and protocols designed to optimize patient safety and efficacy of care, particularly in time-critical conditions. This systematic evaluation ensures that critical information is gathered efficiently to inform immediate treatment decisions, thereby representing best professional practice. Incorrect approaches analysis. One incorrect approach would be to perform a comprehensive, head-to-toe physical examination before initiating the focused neurological assessment. This would delay the critical evaluation of stroke-specific deficits and potentially miss the therapeutic window for time-sensitive interventions, violating the principle of prioritizing life-saving measures in acute neurological emergencies. Another incorrect approach would be to rely solely on patient self-report without objective neurological testing. This is ethically and professionally unsound, as it bypasses the specialist's expertise and the need for objective data to confirm and quantify neurological deficits, potentially leading to misdiagnosis or delayed treatment. Furthermore, neglecting to assess vital signs concurrently with the neurological exam is a failure to recognize the interconnectedness of physiological stability and neurological function, which is a fundamental aspect of neurological assessment and patient care. Professional reasoning. Professionals faced with suspected acute stroke must employ a decision-making framework that prioritizes rapid assessment of critical neurological deficits and vital signs. This involves activating established stroke protocols, performing a focused and systematic neurological examination, e.g., NIS, and concurrently monitoring vital signs. The process should be iterative, with findings guiding further investigation and intervention. Adherence to institutional protocols and national guidelines, which are often informed by regulatory requirements for specialist practice, is paramount. This ensures that care is delivered in a timely, evidence-based, and ethically responsible manner, maximizing the potential for positive patient outcomes. Question 10. Investigation of a patient presenting with suspected new-onset tremor and gait disturbance requires a thorough neurological history. The patient, a 78-year-old male, appears anxious and has difficulty maintaining eye contact, occasionally responding to questions with tangential or irrelevant statements. The clinician is attempting to elicit information about the onset, progression, and associated symptoms of his tremor. Which of the following approaches best facilitates a comprehensive and accurate neurological history in this challenging scenario? Option A. Rely solely on the accompanying family member for all historical details, without attempting to engage the patient directly in the history taking. Option B. Focus exclusively on objective physical examination findings, as the patient's verbal responses are unreliable due to his apparent cognitive difficulties. Option C. Proceed with a rapid-fire series of closed-ended questions to quickly gather as much factual data as possible before the patient becomes more agitated. Option D. Systematically employ open-ended questions, allowing ample time for responses and gently redirecting the patient back to the topic when necessary, while also considering the value of collateral information from a family member present. The correct answer is D. Systematically employ open-ended questions, allowing ample time for responses, and gently redirecting the patient back to the topic when necessary, while also considering the value of collateral information from a family member present. Explanation. This scenario presents a professional challenge due to the inherent complexity of neurological history taking, particularly when a patient exhibits signs of cognitive impairment or communication difficulties. The need to elicit accurate and comprehensive information is paramount for effective diagnosis and management, yet these challenges can significantly impede the process. Careful judgment is required to balance the need for thoroughness with the patient's capacity and comfort. The correct approach represents best professional practice because it prioritizes patient-centered care and adheres to ethical principles of autonomy and beneficence. By employing a structured yet flexible approach, the clinician aims to maximize information gathering while respecting the patient's dignity and limitations. This involves adapting communication strategies, utilizing collateral information judiciously, and ensuring the patient's understanding and consent, aligning with professional guidelines that emphasize comprehensive assessment and patient involvement. An incorrect approach that relies solely on direct questioning, without adapting to the patient's cognitive state, fails to acknowledge the potential for impaired recall or comprehension, leading to incomplete or inaccurate history. This could violate the ethical duty to provide competent care and potentially lead to misdiagnosis or inappropriate treatment, contravening the principle of non-maleficence. Another incorrect approach that bypasses the patient entirely to gather information from a caregiver without attempting to involve the patient or assess their capacity for participation, where possible, risks undermining the patient's autonomy and right to be involved in their own care. While caregiver input is valuable, it should not be the sole source of information if the patient has any capacity to contribute, as this could be seen as a failure to respect the patient's personhood. A further incorrect approach that dismisses the patient's subjective experience due to perceived cognitive deficits, without a systematic attempt to clarify or validate their statements, can lead to a biased and incomplete history. This overlooks the possibility that even with cognitive impairment, patients can offer valuable insights into their symptoms and experiences, and failing to explore these can be detrimental to care. The professional reasoning process for similar situations should involve an initial assessment of the patient's communication and cognitive status. If impairment is suspected, the clinician should then employ adaptive questioning techniques, such as using simpler language, shorter sentences, and providing more time for responses. Simultaneously, the clinician should consider the need for collateral information from family or caregivers, ensuring that this is obtained with appropriate consent, and that the patient is involved to the extent possible. The goal is always to build a comprehensive and accurate picture of the patient's neurological condition while upholding their rights and dignity. Question 11. What factors determine the optimal sequence and interpretation of reflex and coordination testing in a patient presenting with suspected neurological dysfunction? Option A. The availability of specific diagnostic equipment for reflex testing. Option B. The order in which reflexes are typically listed in a standard textbook. Option C. The clinician's personal preference for performing certain tests first. Option D. The patient's presenting symptoms, medical history, observed motor deficits, and potential confounding factors influencing motor performance. Correct answer is D. The patient's presenting symptoms, medical history, observed motor deficits, and potential confounding factors influencing motor performance. Explanation. Scenario analysis. This scenario is professionally challenging because accurately assessing reflexes and coordination is fundamental to neurological diagnosis and management. The specialist must integrate multiple pieces of information, including patient history, observed motor function, and the results of specific tests, to form a coherent clinical picture. Misinterpretation can lead to delayed or incorrect diagnoses, impacting patient outcomes. The challenge lies in the nuanced interpretation of subtle findings and the potential for variability in patient presentation due to factors beyond the neurological condition itself. Correct approach analysis. The correct approach represents best professional practice because it emphasizes a systematic, evidence-based, and patient-centered methodology. It prioritizes a comprehensive assessment that considers the patient's overall clinical context, including their medical history, current symptoms, and any confounding factors that might influence reflex or coordination testing. This aligns with the ethical obligation to provide competent and individualized care, ensuring that diagnostic conclusions are robust and clinically relevant. Adherence to established neurological assessment protocols, as guided by professional bodies and current literature, is paramount for diagnostic accuracy and patient safety. Incorrect approach is analysis. One incorrect approach fails by relying solely on a limited set of standardized reflex tests without considering the broader clinical picture. This is a regulatory and ethical failure because it neglects the principle of holistic patient care and can lead to oversimplified or inaccurate diagnoses. It bypasses the requirement for thorough clinical reasoning and may miss crucial diagnostic clues present in the patient's history or other observed deficits. Another incorrect approach is to prioritize speed and efficiency over thoroughness in testing. This is a failure of professional responsibility and potentially a breach of ethical standards related to patient well-being. Rushing through assessments increases the risk of missing subtle but significant findings, leading to diagnostic errors and potentially compromising patient safety and the quality of care. A third incorrect approach involves interpreting findings in isolation, without correlating them with the patient's reported symptoms or other neurological signs. This represents a failure in diagnostic integration and clinical reasoning, which are core competencies for a specialist. It is ethically problematic as it deviates from best practice in neurological assessment, which demands synthesis of all available data to arrive at a valid conclusion. Professional reasoning. Professionals should approach reflex and coordination testing by first obtaining a detailed patient history, including the onset, nature, and progression of symptoms. This is followed by a systematic physical examination, beginning with general observation and then proceeding to specific neurological tests. The interpretation of each finding should be contextualized within the patient's overall clinical presentation. When results are equivocal or unexpected, further investigation or consultation may be warranted. Decision-making should always be guided by evidence-based practice, ethical principles, and a commitment to patient-centered care, ensuring that diagnostic conclusions are accurate and lead to appropriate management strategies. Question 12. When evaluating a patient presenting with persistent symptoms following a mild traumatic brain injury, which approach best reflects current best practices for diagnosing and managing suspected post-concussion syndrome? Option A. A diagnostic approach relying primarily on objective neuroimaging findings to confirm structural brain damage as the sole cause of persistent symptoms. Option B. Comprehensive assessment including detailed symptom history, neurological examination, cognitive screening, and exploration of psychosocial factors, with a focus on functional recovery and patient education. Option C. A management strategy that involves prescribing medication for all reported symptoms without a thorough differential diagnosis or consideration of non-pharmacological interventions. Option D. A dismissive stance towards subjective symptom reporting, attributing all persistent complaints to psychological distress without a comprehensive neurological workup. The correct answer is B. A comprehensive assessment including detailed symptom history, neurological examination, cognitive screening, and exploration of psychosocial factors, with a focus on functional recovery and patient education. Explanation. This scenario is professionally challenging because post-concussion syndrome, PCS, presents with a complex constellation of symptoms that can significantly impact a patient's quality of life and functional capacity. The neurologist must navigate subjective patient reports, objective neurological findings, or lack thereof, and the potential for multifactorial influences on symptom presentation. The diagnostic and management process requires a holistic approach that considers the patient's physical, cognitive, emotional, and social well-being, all within the framework of established clinical guidelines and ethical practice. The correct approach represents best professional practice because it prioritizes a comprehensive, patient-centered evaluation that aligns with current neurological guidelines for concussion and PCS management. This involves a thorough history, detailed symptom assessment, neurological examination, and consideration of contributing factors. It emphasizes a collaborative approach with the patient, involving shared decision-making regarding management strategies, which is ethically mandated and promotes patient adherence and better outcomes. This approach respects the patient's experience and aims to restore function and improve quality of life, adhering to the principles of beneficence and non-maleficence. An incorrect approach that focuses solely on objective neurological findings and dismisses subjective symptom reporting fails to acknowledge the reality of PCS, where objective findings may be absent or inconsistent with the patient's reported disability. This approach risks misdiagnosis, inadequate treatment, and patient dissatisfaction, potentially violating ethical obligations to provide thorough care. Another incorrect approach that relies on a single diagnostic test or a narrow interpretation of symptoms overlooks the complexity of PCS and the need for a broader differential diagnosis and individualized management plan. This can lead to delayed or incorrect diagnoses and suboptimal patient care, potentially breaching professional standards of care. An approach that neglects to consider psychosocial factors or the patient's functional impact in their daily life and work fails to address the multifaceted nature of PCS and its impact, leading to incomplete management and potentially exacerbating the condition. Professionals should employ a systematic decision-making process that begins with a broad differential diagnosis, followed by targeted investigations based on the patient's presentation. This involves active listening, empathetic engagement with the patient, and a commitment to evidence-based practice. When faced with diagnostic uncertainty, consultation with colleagues or referral to specialized services should be considered. The process should always prioritize the patient's well-being and functional recovery, with clear communication and shared decision-making throughout the management journey. Question 13. Operational review demonstrates a patient presenting to the emergency department following a witnessed fall from standing height. The patient is awake but appears disoriented to time and place, with a reported brief loss of consciousness at the scene. Initial assessment reveals no gross external head trauma, considering the potential for various types of traumatic brain injury, TBI. Which of the following diagnostic strategies best aligns with current neurological best practices for this presentation? Option A. Focus on the patient's reported brief loss of consciousness and provide symptomatic treatment for headache, deferring further investigation unless symptoms worsen significantly. Option B. Rely solely on the patient's ability to ambulate and communicate coherently to rule out significant intracranial injury, as this indicates a lack of severe TBI. Option C. Administer a standardized concussion assessment tool and observe the patient for 2 hours, assuming a mild TBI given the mechanism of injury. Option D. Perform a detailed neurological examination, including assessment of mental status, cranial nerves, and motor/sensory function, and obtain urgent neuroimaging, CT scan of the head, to evaluate for structural abnormalities. The correct answer is D. Perform a detailed neurological examination, including assessment of mental status, cranial nerves, and motor/sensory function, and obtain urgent neuroimaging, CT scan of the head, to evaluate for structural abnormalities. Explanation. This scenario presents a professional challenge due to the critical need for accurate and timely diagnosis of traumatic brain injury, TBI, in a patient presenting with altered mental status following a fall. The nuances between different types of TBI, such as concussion, contusion, and diffuse axonal injury, DI, require a sophisticated understanding of their underlying pathophysiology, clinical presentations, and diagnostic indicators. Misclassification can lead to delayed or inappropriate management, potentially impacting patient outcomes and adherence to clinical best practices. The correct approach represents best professional practice because it prioritizes a comprehensive diagnostic strategy that integrates clinical assessment with appropriate neuroimaging. This aligns with established neurological guidelines and regulatory frameworks that mandate thorough evaluation of suspected TBI. Specifically, a detailed neurological examination to assess for focal deficits, level of consciousness, and cognitive function, coupled with neuroimaging, such as CT or MRI, to identify structural lesions like contusions or evidence suggestive of DAI, is crucial for accurate diagnosis and subsequent management planning. This approach ensures that the patient receives the most appropriate level of care, from observation for a mild concussion to immediate surgical intervention for a significant contusion or aggressive management for severe DAI. An incorrect approach that relies solely on a brief clinical assessment without neuroimaging fails to meet the standard of care for suspected TBI. This is a regulatory and ethical failure because it risks overlooking significant intracranial pathology. For instance, a seemingly mild concussion could mask an underlying contusion that requires intervention, or a patient with subtle symptoms might have DAI that necessitates specialized monitoring and management. Another incorrect approach, focusing only on the mechanism of injury without a thorough clinical and imaging workup, is similarly flawed. The mechanism provides context, but does not replace the need for objective diagnostic data. Ethically, this represents a failure to act in the patient's best interest by not pursuing a definitive diagnosis. The professional decision-making process for similar situations should involve a systematic approach. 1. Obtain a detailed history of the injury and the patient's symptoms. 2. Conduct a thorough neurological examination, assessing mental status, cranial nerves, motor and sensory function and reflexes. 3. Consider the mechanism of injury and the patient's risk factors. 4. Based on the clinical findings and mechanism, determine the necessity and type of neuroimaging. 5. Interpret the clinical and imaging findings in conjunction to arrive at a diagnosis, differentiating between TBI subtypes. 6. Formulate a management plan tailored to the specific diagnosis and severity of the TBI. This structured approach ensures all critical diagnostic steps are considered, minimizing the risk of diagnostic error and optimizing patient care within the established regulatory and ethical guidelines for neurological practice. Question 14. Stakeholder feedback indicates that patients with progressive neurodegenerative diseases often experience fluctuating cognitive capacity, leading to challenges in consistently expressing their wishes regarding future medical interventions. A patient diagnosed with early-stage Alzheimer's disease, who has a supportive family and has previously expressed a desire to avoid aggressive life-sustaining treatments, is currently exhibiting moments of lucidity and moments of confusion. The clinical team is considering initiating a new, potentially burdensome treatment that could prolong life, but may significantly impact quality of life. What is the most appropriate course of action for the clinical team? Option A. Engage in a comprehensive discussion with the patient about the proposed treatment, its risks and benefits, and their previously expressed wishes, while simultaneously working with the family to identify and formalize a healthcare proxy, if one is not already in place, to ensure continuity of decision-making as the disease progresses. Option B. Implement the new treatment immediately, given the potential for life prolongation, and address any patient or family concerns about quality of life after the treatment has begun. Option C. Proceed with the new treatment based on the family's strong advocacy for its initiation, as they are most familiar with the patient's overall well-being and are likely to make decisions aligned with the patient's best interests. Option D. Delay the decision regarding the new treatment until the patient's cognitive status definitively declines to a point where they can no longer participate in any decision-making, at which time the family can assume full responsibility. The correct answer is A. Engage in a comprehensive discussion with the patient about the proposed treatment, its risks and benefits, and their previously expressed wishes, while simultaneously working with the family to identify and formalize a healthcare proxy, if one is not already in place, to ensure continuity of decision-making as the disease progresses. Explanation. Scenario analysis. This scenario is professionally challenging because it requires balancing the immediate needs and preferences of a patient with neurodegenerative disease against the long-term implications of treatment decisions and the ethical imperative to ensure informed consent. The progressive nature of these diseases can impact cognitive function, making it difficult for patients to fully grasp complex medical information and make consistent decisions over time. The involvement of family members, while often beneficial, can also introduce differing opinions and potential conflicts regarding the patient's best interests. Correct approach analysis. The correct approach, which involves a comprehensive discussion with the patient and their designated healthcare proxy, represents best professional practice by adhering to the principles of patient autonomy and beneficence. It acknowledges the patient's right to participate in their care to the extent of their capacity, while also ensuring that a legally recognized individual is prepared to make decisions when the patient's capacity diminishes. This aligns with ethical guidelines that prioritize shared decision-making and respect for patient wishes, even when those wishes may evolve. Regulatory frameworks for healthcare professionals in the U.S. emphasize the importance of obtaining informed consent, which includes ensuring the patient understands their condition, treatment options, risks, and benefits. When capacity is fluctuating or likely to decline, proactive planning with a proxy is a standard and ethically sound practice. Incorrect approaches analysis. One incorrect approach would be to solely rely on the family's wishes without a thorough assessment of the patient's current capacity and prior expressed preferences. This fails to uphold patient autonomy and could lead to decisions that do not align with what the patient would have wanted, potentially violating ethical principles and regulatory requirements for informed consent. It also bypasses the established legal mechanism of a healthcare proxy. Another incorrect approach would be to proceed with a significant treatment change based solely on the patient's current, potentially transient, expression of desire, without considering the long-term prognosis and the need for a stable decision-making plan. This neglects the progressive nature of neurodegenerative diseases and the importance of ensuring continuity of care and decision-making authority, which could be seen as a failure to act in the patient's best interest and a deviation from best practice in managing chronic, progressive conditions. A third incorrect approach would be to delay any discussion about future care planning until the patient has completely lost capacity. This is a reactive rather than proactive strategy, which is suboptimal for managing neurodegenerative diseases. It creates an urgent and potentially distressing situation for both the patient and their family, and it misses the opportunity to involve the patient in decisions about their care while they still have some level of understanding and can express their values. This can lead to decisions being made under duress or without adequate information, which is ethically and professionally unsound. Professional reasoning. Professionals should adopt a framework that prioritizes ongoing assessment of patient capacity, open communication with the patient and their support system, and proactive planning for future care needs. This involves understanding the patient's values, goals of care, and preferences, and documenting these discussions. When capacity is compromised or likely to decline, engaging with designated healthcare proxies or legal guardians is crucial. This process should be iterative, allowing for adjustments as the patient's condition and wishes evolve, always striving to maximize patient involvement and ensure decisions are made in their best interest, in accordance with legal and ethical standards. Question 15. The assessment process reveals subtle, nonspecific white matter hyperintensities on an MRI brain scan of a patient presenting with mild, intermittent cognitive complaints. While these findings are not definitively indicative of a specific neurodegenerative process, they could be interpreted as such by a less experienced clinician or the patient themselves. The referring neurologist has requested an interpretation from the neurology clinical specialist, NCS, to aid in differential diagnosis and management planning. What is the most ethically and professionally sound approach for the NCS to take in interpreting and communicating these findings? Option A. Provide a detailed report that meticulously describes the observed white matter hyperintensities, discusses their potential differential diagnoses, including age-related changes and early neurodegenerative processes, and emphasizes the need for clinical correlation and serial imaging if indicated, without overstating their significance. Option B. State in the report that the MRI findings are largely unremarkable and do not warrant further investigation, as the hyperintensities are too subtle to be clinically significant. Option C. Conclude that the white matter hyperintensities are likely indicative of early Alzheimer's disease and recommend immediate initiation of pharmacotherapy, as this is the most concerning potential diagnosis given the patient's symptoms. Option D. Focus solely on the most concerning potential diagnosis, Alzheimer's disease, and omit any mention of other possible etiologies or the nonspecific nature of the findings to avoid confusing the referring physician. The correct answer is A. Provide a detailed report that meticulously describes the observed white matter hyperintensities, discusses their potential differential diagnoses including age-related changes and early neurodegenerative processes, and emphasizes the need for clinical correlation and serial imaging if indicated, without overstating their significance. Explanation. This scenario presents an ethical dilemma rooted in the responsible interpretation and communication of neuroimaging findings, particularly when those findings are subtle or potentially misleading. The challenge lies in balancing the imperative to provide accurate diagnostic information with the need to avoid causing undue patient anxiety or influencing clinical decisions based on uncertain or incomplete data. The neurology clinical specialist, NCS, must navigate the complexities of interpreting nuanced imaging results, understanding their clinical significance, and communicating them appropriately to the referring physician. The correct approach prioritizes a thorough, evidence-based interpretation and clear, objective communication. This aligns with professional ethical standards that mandate competence, integrity, and responsible practice. By thoroughly reviewing the imaging, considering the clinical context, and communicating findings with appropriate caveats, the NCS upholds their duty of care to the patient and supports the referring physician's decision-making process. This approach ensures that diagnostic information is presented in a way that is both informative and ethically sound, minimizing the risk of misinterpretation or iatrogenic harm. An incorrect approach would involve making definitive pronouncements on subtle findings without sufficient corroboration or clinical correlation. This could lead to misdiagnosis, unnecessary further investigations, or patient distress. Another incorrect approach would be to withhold potentially relevant information due to uncertainty, which could impede timely diagnosis and treatment. Failing to consider the clinical context when interpreting imaging is also a significant ethical lapse, as neuroimaging findings are rarely interpreted in isolation. Each of these incorrect approaches violates principles of professional responsibility, potentially leading to patient harm and undermining the NCS's credibility. Professionals should approach such situations by adopting a systematic decision-making process. This involves first ensuring they possess the necessary expertise to interpret the specific imaging modality and findings. Next, they must meticulously review the imaging in conjunction with all available clinical information. If uncertainty exists, seeking consultation with a senior colleague or radiologist is paramount. Communication should always be clear, objective, and contextualized, highlighting both significant findings and areas of uncertainty. The ultimate goal is to provide actionable, reliable information that aids in patient care while adhering to the highest ethical standards. Question 16. Governance review demonstrates that the implementation of standardized neuropsychological testing protocol for patients referred for cognitive assessment in a neurology clinic is facing challenges related to patient engagement and test completion rates. The clinical specialist team is considering several strategies to address this. Which approach best balances the need for comprehensive, valid assessment with patient well-being and clinical efficiency? Option A. Rely primarily on clinical interviews and informal cognitive screening tools, supplementing with a limited number of standardized tests only when significant deficits are suspected. Option B. Develop flexible assessment protocols that allow for the selection of specific tests based on the referral question and patient's presentation, with provisions for breaks and alternative assessment methods if fatigue or distress is observed. Option C. Implement a fixed, comprehensive neuropsychological test battery for all patients, regardless of referral question or observed fatigue, to ensure all cognitive domains are covered. Option D. Reduce the duration of standardized tests by administering fewer items or omitting certain subtests to expedite the assessment process and improve completion rates. Correct answer is C. Implement a fixed, comprehensive neuropsychological test battery for all patients, regardless of referral question or observed fatigue, to ensure all cognitive domains are covered. Explanation. Scenario analysis. This scenario presents a common implementation challenge in neuropsychological testing within a clinical specialist neurology setting. The challenge lies in balancing the need for standardized, evidence-based assessment with the practical realities of patient care, including time constraints, resource availability, and the potential for patient fatigue or distress. Ensuring the validity and reliability of test results while maintaining patient well-being and adhering to professional standards requires careful judgment and a nuanced approach. Correct approach analysis. The correct approach prioritizes a comprehensive, individualized assessment that considers the patient's specific clinical presentation and functional goals. This involves selecting appropriate tests based on the referral question, the patient's cognitive strengths and weaknesses, and their ability to participate effectively. It also necessitates adapting the testing environment and procedure to minimize distress and maximize engagement, while meticulously documenting all procedures and findings. This aligns with the ethical principles of beneficence and non-maleficence, ensuring the patient receives the most accurate and useful information possible without undue harm. Furthermore, it upholds professional standards by ensuring the assessment is conducted with scientific rigor and clinical relevance, as expected of a neurology clinical specialist. Incorrect approaches analysis. One incorrect approach involves rigidly adhering to a predefined battery of tests, regardless of the patient's condition or the specific referral question. This fails to acknowledge the individualized nature of neuropsychological assessment and can lead to the collection of irrelevant data, patient frustration, and potentially inaccurate conclusions. Ethically, this approach may violate the principle of beneficence by not providing the most relevant information for the patient's care. Another incorrect approach is to significantly shorten or omit sections of standardized tests to save time. This compromises the psychometric properties of the tests, rendering the results invalid and unreliable. Such a practice would be a direct violation of professional standards and could lead to misdiagnosis or inappropriate treatment recommendations, thus failing the duty of care. A third incorrect approach is to rely solely on subjective observations and informal assessments without the use of standardized, validated neuropsychological instruments. While clinical observation is crucial, it cannot replace the objective data provided by standardized testing. This approach lacks the scientific rigor required for a neurology clinical specialist and could lead to biased interpretations, failing to meet the standards of evidence-based practice. Professional reasoning. Professionals should approach neuropsychological testing by first thoroughly understanding the referral question and the patient's history. This guides the selection of appropriate assessment tools. A flexible yet systematic approach is crucial, allowing for adaptation to individual patient needs while maintaining the integrity of the testing process. Documentation should be meticulous, detailing all procedures, observation, and any deviations from standard protocols, along with their rationale. Continuous professional development and adherence to ethical guidelines are paramount in ensuring high-quality patient care. Question 17. Market research demonstrates varying patient outcomes in long-term rehabilitation for chronic neurological conditions. Considering the regulatory framework for neurological rehabilitation services, which approach to developing a long-term rehabilitation plan for a patient with persistent motor deficits following a stroke, is most aligned with best professional practice and regulatory compliance. Option A. Implementing a multidisciplinary rehabilitation program that includes tailored physiotherapy, occupational therapy, and speech-language pathology interventions, with regular reassessment of functional goals and progress based on evidence-based outcome measures. Option B. Continuing a standardized, high-intensity exercise program that has shown some anecdotal improvement in similar patient populations, without formal reassessment of specific functional deficits or patient-reported goals. Option C. Recommending a transition to community-based recreational activities as the primary form of rehabilitation, with minimal clinical oversight, to reduce healthcare costs. Option D. Focusing exclusively on assistive device prescription and training, assuming that further functional recovery beyond basic mobility is unlikely given the chronicity of the condition. The correct answer is A. Implementing a multidisciplinary rehabilitation program that includes tailored physiotherapy, occupational therapy, and speech-language pathology interventions, with regular reassessment of functional goals and progress based on evidence-based outcome measures. Explanation. This scenario presents a common challenge in neurology clinical practice, determining the most effective long-term rehabilitation strategy for patients with chronic neurological conditions, balancing evidence-based practice with individual patient needs and resource availability. The professional challenge lies in synthesizing complex patient data, understanding the nuances of different rehabilitation modalities, and aligning these with the patient's goals and the established regulatory framework for neurological rehabilitation services. Careful judgment is required to avoid premature closure on a single approach and to ensure a patient-centered, ethically sound, and regulatory compliant plan. The correct approach represents best professional practice because it prioritizes a comprehensive, individualized assessment that considers the patient's current functional status, specific neurological deficits, and personal goals for long-term recovery and quality of life. This aligns with the ethical principles of beneficence and autonomy, ensuring that the rehabilitation plan is tailored to the individual and respects their right to participate in decision-making. Furthermore, it adheres to regulatory guidelines that emphasize evidence-based interventions and the need for ongoing reassessment to optimize outcomes and justify continued service provision. This approach fosters a collaborative relationship between the clinician and patient, promoting adherence and maximizing the potential for meaningful functional gains over the long term. An incorrect approach that focuses solely on a single, unproven, or outdated therapeutic modality fails to meet the regulatory requirement for evidence-based practice. May also violate ethical principles by not offering the patient the most effective available interventions, potentially leading to suboptimal outcomes and wasted resources. Another incorrect approach that neglects to involve the patient in goal setting or decision-making undermines patient autonomy and can lead to disengagement from the rehabilitation program, ultimately hindering long-term success and potentially contravening ethical obligations to respect patient rights. An approach that prioritizes cost-effectiveness over clinical efficacy, without a clear rationale supported by evidence and patient benefit, would also be a regulatory and ethical failure, as it could lead to the provision of substandard care. The professional decision-making process for similar situations should involve a systematic evaluation of the patient's condition, a thorough review of current evidence for various rehabilitation interventions, and open communication with the patient and their family. Clinicians should utilize validated assessment tools to establish baseline function and track progress. They must also be aware of and adhere to all relevant regulatory guidelines pertaining to the scope of practice, documentation, and the provision of neurological rehabilitation services. This iterative process of assessment, intervention, and reassessment, guided by evidence and patient-centered goals, is crucial for effective long-term management. Question 18. Compliance review shows a neurologist is managing a patient presenting with new onset, fluctuating weakness, and sensory disturbances. The neurologist has conducted an initial physical examination and reviewed the patient's basic medical history. Which of the following represents the most appropriate next step in the assessment and management strategy, adhering to best professional practice and regulatory expectations for neurological care? Option A. Advise the patient to rest and monitor symptoms at home, deferring further investigations until the symptoms become more severe or persistent. Option B. Immediately initiate high-dose corticosteroids and plasmapheresis to address the potential for an autoimmune process, given the fluctuating nature of the symptoms. Option C. Focus solely on managing the reported sensory symptoms with analgesics while awaiting further clarification of the weakness from the patient. Option D. Develop a comprehensive, individualized management plan that incorporates further diagnostic investigations, symptomatic treatment, and consideration of rehabilitation, based on a detailed neurological assessment and review of all available clinical data. The correct answer is D. Develop a comprehensive, individualized management plan that incorporates further diagnostic investigations, symptomatic treatment, and consideration of rehabilitation, based on a detailed neurological assessment and review of all available clinical data. Explanation. Scenario analysis. This scenario presents a common challenge in neurology clinical practice, balancing the immediate needs of a patient with complex neurological symptoms against the need for thorough, evidence-based assessment and management. The challenge lies in the potential for rapid deterioration, the subjective nature of some neurological symptoms, and the pressure to provide timely interventions while adhering to established clinical guidelines and regulatory requirements. The neurologist must navigate diagnostic uncertainty, patient and family expectations, and resource limitations. Correct approach analysis. The correct approach prioritizes a comprehensive, systematic assessment that integrates multiple data sources. This includes a detailed neurological examination, review of relevant medical history and investigations, and consideration of the patient's functional status and quality of life. This aligns with the principles of patient-centered care and evidence-based practice, which are fundamental to professional conduct and regulatory compliance in neurological care. By developing a tailored management plan based on this thorough assessment, the neurologist ensures that interventions are appropriate, effective, and minimize risks, thereby upholding professional standards and patient safety. Incorrect approaches analysis. One incorrect approach involves initiating aggressive, broad-spectrum treatments based solely on initial symptom presentation, without a comprehensive diagnostic workup. This fails to adhere to the principle of judicious use of resources and can lead to unnecessary patient exposure to potential side effects, masking of underlying conditions, and delayed diagnosis of the true pathology. Ethically, it represents a failure to provide care that is both necessary and appropriate. Another incorrect approach is to defer definitive management decisions until all possible diagnostic tests are completed, even if the patient is experiencing significant distress or functional impairment. This can lead to prolonged suffering and potentially irreversible neurological damage, violating the ethical duty to alleviate suffering and act in the patient's best interest. It also overlooks the importance of timely intervention when indicated by clinical presentation. A third incorrect approach is to rely solely on patient self-report without objective neurological examination or corroborating investigations. While patient experience is crucial, neurological conditions often require objective assessment to confirm findings, differentiate between similar presentations, and guide treatment. This approach risks misdiagnosis and inappropriate management, failing to meet professional standards of care. Professional reasoning. Professionals should employ a structured decision-making process that begins with a thorough assessment, moving to differential diagnosis, and then to evidence-based treatment planning. This process should be iterative, allowing for adjustments based on new information or patient response. Key considerations include patient safety, efficacy of interventions, patient preferences, and adherence to established clinical guidelines and regulatory frameworks. A commitment to continuous learning and critical appraisal of evidence is essential for maintaining competence and providing optimal neurological care. Question 19. The risk matrix shows a patient with Parkinson's disease expressing a strong desire to discontinue their dopaminergic medication due to perceived side effects and a lack of significant motor improvement. However, the clinical team has observed a decline in their non-motor symptoms, including apathy and mild cognitive impairment, which have worsened in parallel with their stated desire to stop treatment. The patient's family reports that the patient has become increasingly withdrawn and less engaged in activities they previously enjoyed. Considering the complex interplay of motor and non-motor symptoms and their potential impact on decision-making capacity, what is the most ethically and professionally appropriate course of action? Option A. Respect the patient's autonomy and immediately discontinue the medication as requested, focusing solely on managing any potential motor fluctuations that may arise. Option B. Increase the dosage of the current medication to address the perceived lack of motor improvement, without further discussion of the patient's desire to stop treatment. Option C. Refer the patient for a psychiatric evaluation to address their apathy and withdrawal, without directly addressing their request to discontinue Parkinson's medication. Option D. Initiate a formal capacity assessment to determine the patient's ability to make informed decisions about their medication, while continuing current treatment to prevent symptom exacerbation and engaging in a detailed discussion about their concerns and the benefits of medication for both motor and non-motor symptoms. The correct answer is D. Initiate a formal capacity assessment to determine the patient's ability to make informed decisions about their medication, while continuing current treatment to prevent symptom exacerbation and engaging in a detailed discussion about their concerns and the benefits of medication for both motor and non-motor symptoms. Explanation. This scenario presents a professional challenge due to the inherent conflict between a patient's expressed wishes and the clinician's assessment of their capacity and best interests, particularly when dealing with the complex interplay of motor and non-motor symptoms in a neurological condition. The patient's desire to discontinue medication, despite evidence of its benefit for both motor and non-motor symptoms, raises questions about their understanding of the risks and benefits and their capacity to make informed decisions. The clinician must navigate this delicate situation with empathy, respect for autonomy, and a commitment to patient well-being, all within the established regulatory and ethical frameworks for neurological care. The correct approach represents best professional practice because it prioritizes a thorough, multifaceted assessment of the patient's capacity and the underlying reasons for their decision. This involves a comprehensive evaluation of both motor and non-motor symptoms, as these can significantly impact cognitive function, mood, and insight, thereby influencing decision-making capacity. Engaging in open, empathetic communication to understand the patient's perspective, exploring their concerns about medication side effects or perceived lack of efficacy, and involving their support network with consent are crucial steps. This approach aligns with the ethical principles of beneficence, acting in the patient's best interest, non-maleficence, avoiding harm, respect for autonomy, acknowledging the patient's right to self-determination, provided they have capacity, and justice, fair and equitable treatment. It also adheres to regulatory guidelines that mandate informed consent, capacity assessment, and patient-centered care, ensuring that any decision regarding treatment is made collaboratively and with full understanding. An incorrect approach that involves immediately overriding the patient's wishes and enforcing continued medication without a thorough capacity assessment would represent a significant ethical and regulatory failure. This would violate the principle of respect for autonomy and could lead to a breakdown in the therapeutic relationship. Failing to explore the non-motor symptoms that might be contributing to the patient's desire to stop medication, such as depression, anxiety, or cognitive impairment, would be a failure of beneficence, as it neglects potential underlying issues impacting their decision-making. Another incorrect approach, such as discontinuing medication solely based on the patient's request without a formal capacity assessment or exploring alternatives, would also be a failure of professional responsibility, potentially leading to a decline in the patient's motor function and overall quality of life, thus violating the principle of non-maleficence. Professional decision-making in such situations requires a systematic process. First, the clinician must assess the patient's capacity to make the specific decision at hand, considering their understanding of the information, appreciation of the consequences, ability to reason, and capacity to communicate a choice. Second, if capacity is in question, a more in-depth assessment, potentially involving other specialists, is warranted. Third, open and empathetic communication is paramount to understand the patient's rationale and address their concerns. Fourth, exploring all available treatment options, including alternative medications or non-pharmacological interventions, is essential. Finally, decisions should be documented thoroughly, reflecting the assessment, discussions, and rationale for the chosen course of action, always prioritizing the patient's safety and well-being within the legal and ethical framework. Question 20. The efficiency study reveals that the neurology clinic is experiencing significant time constraints during outpatient consultations, impacting the thoroughness of gait and balance assessments. Given these limitations, which approach to gait and balance assessment would be most professionally appropriate and aligned with best practices for a neurology clinical specialist? Option A. Implement a standardized, prioritized battery of validated gait and balance assessment tools, focusing on those most sensitive to common neurological impairments, and reserve more in-depth assessments for cases where initial findings warrant further investigation. Option B. Conduct a comprehensive, multi-component gait and balance assessment that includes every possible validated test, regardless of the time constraints or the patient's specific presentation. Option C. Focus exclusively on static balance exercises and assessments, assuming that improvements in static balance will naturally translate to better dynamic gait and overall balance. Option D. Rely primarily on the patient's subjective report of gait and balance difficulties, supplemented by brief, non-standardized observational notes during the physical examination. The correct answer is A. Implement a standardized, prioritized battery of validated gait and balance assessment tools, focusing on those most sensitive to common neurological impairments, and reserve more in-depth assessments for cases where initial findings warrant further investigation. Explanation. Scenario analysis. This scenario presents a common challenge in clinical practice where time constraints necessitate efficient yet thorough patient assessment. The neurologist must balance the need for comprehensive gait and balance evaluation with the practical realities of a busy clinic. Overlooking critical components due to time pressure can lead to misdiagnosis or delayed intervention, impacting patient outcomes. The professional challenge lies in optimizing the assessment process without compromising diagnostic accuracy or patient safety. Correct approach analysis. The optimal approach involves a structured, prioritized selection of validated gait and balance assessment tools that are sensitive to common neurological impairments affecting these domains. This aligns with best professional practice by ensuring that the most relevant and informative assessments are performed within the allotted time. Regulatory frameworks and professional guidelines for neurological practice emphasize evidence-based assessment and patient-centered care, which this approach upholds by focusing on tools with established reliability and validity for detecting neurological deficits. Ethical considerations also mandate providing the highest quality of care possible, which includes efficient and effective diagnostic processes. Incorrect approach is analysis. One incorrect approach involves relying solely on subjective observation without standardized tools. This is professionally unacceptable because it lacks objectivity and reproducibility, making it difficult to track changes over time or compare findings with established norms. It fails to meet regulatory expectations for evidence-based practice and can lead to biased interpretations, violating ethical principles of accurate diagnosis. Another incorrect approach is to perform a superficial, non-standardized battery of tests that are not specifically validated for neurological gait and balance assessment. This is problematic as it may not capture subtle but significant neurological deficits, leading to incomplete or inaccurate diagnoses. It deviates from professional standards that require the use of validated instruments and can be seen as a failure to provide adequate care, potentially violating ethical obligations to the patient. A third incorrect approach is to exclusively focus on one aspect of gait or balance, such as only static balance, while neglecting dynamic components or specific gait parameters. This is professionally unsound, as neurological conditions often affect multiple facets of gait and balance in complex ways. Such a narrow focus can lead to overlooking crucial diagnostic clues and fails to provide a holistic assessment, which is a cornerstone of good neurological practice and ethical patient care. Professional reasoning. Professionals should adopt a systematic approach to gait and balance assessment, beginning with a brief clinical interview to identify specific patient concerns related to their gait or balance. This should be followed by a prioritized selection of validated assessment tools, starting with those that screen for common and significant neurological impairments. For example, a timed up-and-go test, a functional reach test, and a brief observation of gait quality, e.g., stride length, base of support, arm swing, can provide a wealth of information efficiently. If these initial assessments reveal abnormalities, or if the patient's history suggests specific deficits, more detailed, specialized assessments can then be employed. This tiered approach ensures that time is used effectively, prioritizing the most informative assessments while allowing for deeper investigation when necessary. This aligns with regulatory requirements for efficient and effective patient care and ethical obligations to provide thorough and accurate assessments.